importance of expanding access to critical medical supplies. We need to shift COVID-19 antiviral medications if they test positive. These programs will also help people, health experts, and civil society to make this happen. As we implement this, and we'll share these lessons with countries around the world, including our providers in the United States, medical oxygen. Medical oxygen is critical for treating patients with severe COVID-19 and to the patient's bedsides. We're also helping lower the cost of oxygen for governments across Africa. Adult pneumonia, safe birth, safe surgery, and new infectious disease outbreaks. Third, clearinghouse mechanism. Our hope is to make supply chains more resilient, the latest ways we're combating COVID-19 and building more resilient global health system pandemics for all. Thank you very much.
Be back with us as soon as possible. I'm very pleased to be here with the Minister for a concrete piece of evidence of how, in a highly connected...
Excellencies attending this conference, allow me to extend my very deep condolences and sympathy to Secretary Blinken for the great loss he suffered today. Health without equity is health with no security. Since the beginning of COVID-19, Thailand has ensured that equity is at the heart of our public health interventions. The world cannot achieve global health security without solidarity, and this is why Thailand is committed to playing its part in the global collaboration to bolster SDGs 3 on 3 counts. First, we work to improve health equity. Domestically, our Universal Health Coverage Scheme protects everyone's health in a non-discriminatory manner that leaves no one behind. We ensure access to health care for everyone, regardless of their level of income, gender, religion, or nationality. Internationally, we pledged to provide $1.5 million USD each year from 2020 to 2024 to the Global Fund to ensure health for all, including, in particular, the vulnerable and those furthest behind. Second, we have utilized our resources to train and motivate relevant stakeholders to engage in the pandemic containment process. We address the global shortfall of health workforce by working with neighboring countries to upgrade their preparedness and response and train new epidemiologists and migrant worker volunteers, numbering more than 1 million in Thailand in particular. Thailand is pleased to be hosting the ASEAN Center for Public Health Emergencies and Emerging Diseases, which is known in short as ACFI, which will contribute to strengthening ASEAN regional capabilities to prepare, prevent, detect, and respond to emerging health emergencies. And third, we have worked towards bolstering supply chain resilience while continuing our efforts to get the SDGs back on track. We are working towards developing stockpiles of health products with an emphasis on sustainability through the use of renewable energy and waste recycling. Excellencies, stronger and fairer architecture needs to be a solid foundation of the global health security, and the global health architecture needs to be reformed for more equity, more inclusivity, and more coherence. And let's work toward finalizing a new pandemic treaty under WHO and promoting complementarity between relevant initiatives, including the financial intermediary funds and sustainable financing reforms of WHO. And for this gap, the global action plan. Let us put our heads, hearts, and soul together. Synergy is key in this endeavor. I thank you.
Thank you, Deputy Prime Minister Pramod Winai. So now is the turn for Africa CDC. So please, Acting Director, Dr. Ahmed Ogwal Uma, the floor is yours.
And that we have devoted almost 500 million and the different vaccine scheme. In that same line, the Global Action Plan is a multilateral effort. That for this, I would like to recognize first and foremost our American friends, and very particularly President Biden and my colleague Secretary of State, Tony Blinken, coordination efforts of line for 4 and organizing in Madrid the past 6 and 7, and is fundamental to improve global health security and to achieve universal health coverage. Moreover, on top of this heroic task, had to combine their jobs.
I think this was captured very well when President Biden said, perhaps we may be just getting out of the pandemic. This therefore requires that his management is integrated into the health systems as other notified. Excellencies, distinguished guests, Botswana has developed a robust delays in the delivery of doses due to prioritization in favor of the vaccine manufacturing countries. And it is putting it to him that the non-communicable diseases are the leading cause of mortality. Almost 20 million people die of non-communicable disease every single year. So we need guidance that requires strengthening our national and global health system to achieve universal health coverage.
Reminded us that health issues can easily turn into global, and without response, we can't beat them. Excellencies, Bangladesh COVID-19 response.
If we vaccinate all health workers and older people, keep testing and expand access to effective antivirals. At the same time, WHO is working with our member states to build a stronger architecture for health emergency preparedness and response with a new pandemic accord and strengthened international health regulations, with enhanced financing through the newly established financial intermediary fund, with enhanced systems and tools for surveillance